In this training, you'll learn what diabetes is, the consequences of diabetes, and first aid for a diabetic emergency. Many people have the idea that diabetes is all about eating too much sugar. And although a high caloric diet and being overweight are risk factors for diabetes, it's so much more complicated than that. So what is diabetes? It's a disease where the body does not make insulin or the body does not use insulin properly. Insulin is a hormone produced by the pancreas that moves sugar known as glucose from the bloodstream into the cells. This is a vital process as glucose is the body's main source of fuel. You see, when we eat sugars, starches, and other foods, glucose gets absorbed into the bloodstream and the insulin moves the glucose into the body's cells so that they're able to produce energy. Insulin is like a key to the door of the body's cells that lets glucose in. And when the normal process of insulin moving glucose into the cells is not working, the cells are starved and not able to produce energy in the correct way from the food that we eat. Diabetes is a serious condition because the glucose levels in the bloodstream will build up to high levels, causing serious health problems. When glucose levels are too high, a person with untreated diabetes can eventually slip into a life-threatening condition known as diabetic ketoacidosis or diabetic coma. The cause of diabetes is generally unknown. However, genetics and environmental conditions are the most common factors. A common misconception is that if a parent has diabetes, the child will have diabetes. This is only true less than 15% of the time. Diabetes is often undiagnosed in early stages, or symptoms are mistaken for common illnesses like the flu. If you notice symptoms in yourself or another person, an appointment with the doctor should be made. The warning signs for diabetes include the following: tiredness, excessive thirst, frequent urination, increased hunger, sudden weight loss, fruity or sweet smell on the breath, or sudden changes in vision. Diabetes is diagnosed as either type 1 or type 2, which is caused by one of three problems. 1, the body's not producing insulin. 2, the body is producing too little insulin. Or 3, the body's cells are resistant to the insulin. Type 1 diabetes is when a person's body does not produce insulin. Typically, a child or a young person that has been diagnosed with diabetes has been diagnosed with type 1 diabetes. According to the American Diabetes Association, type 1 accounts for about 5 to 10% of those diagnosed in the United States. Type 2 diabetes is when the body produces too little insulin or cannot use the insulin that is produced, called insulin resistance. It's the most common form of diabetes and it's on the rise in the United States. Mainly, adults who are overweight and over age 40 are diagnosed with type 2 diabetes. However, as more children and adolescents in the United States become overweight and inactive, type 2 diabetes is becoming more common in young people. It's important to treat diabetes early because complications develop silently and gradually over time. The parts of the body that are most affected by diabetes complications are the eyes, and some of those common problems include cataracts, retinopathy, and glaucoma. The kidneys leads to diabetic nephropathy, and the need for dialysis or kidney transplant eventually. It also affects nerves, causing nerve damage called diabetic neuropathy, especially numbness, tingling, or sharp pains in the feet or lower legs. Heart and blood vessels are also affected. Damage leads to high blood pressure, heart attack, and stroke. Your gums can be affected, which leads to gum disease and early tooth loss. And feet problems always are related to the lack of blood flow and the risk of poor healing, which sometimes gets infected and leads to amputation. So then what is the cure for diabetes? Well, there isn't any. However, that doesn't mean that the person with diabetes is doomed. Diabetes can be managed successfully by eating right, getting regular exercise, properly taking medication, and glucose monitoring on a regular basis. People with type 1 diabetes must take insulin by injection to live. People with type 2 diabetes take glucose-lowering medications by mouth or injection. Adults and especially young people with type 2 diabetes often need insulin in addition to glucose-lowering medications. With both type 1 or type 2 diabetes, the goal is to control blood glucose levels by keeping them within a target range. A normal range on a blood glucose monitor is usually between 80 and 110. However, a normal range will vary and is determined more for each individual depending on their specific needs. Diabetes can lead to the need for first aid when it's out of control. An emergency usually is caused when a person doesn't take their diabetic medicines as directed, doesn't follow the meal plan. They might have problems when they exercise too much or not enough and don't adjust their medications or their diabetic plan, or they suffer from an illness or are having too much stress in their life and they're not checking their blood sugar levels enough to monitor appropriately. A diabetic emergency can happen anytime with or without warning. Too low a blood sugar, called hypoglycemia, is the most common problem and causes rapid changes. This is called insulin shock. Too high of blood sugar is called hyperglycemia, but that takes a longer amount of time to develop and can lead to a diabetic coma. To provide first aid in a diabetic emergency, you don't need to know whether a person has type 1 or type 2 diabetes, or whether a person's glucose levels are too high or too low. The most important thing is to recognize an emergency and provide first aid as needed. Diabetic emergency signs and symptoms include the following: altered level consciousness, pale, sweaty skin, shakiness, personality changes, irritability, weakness, dizziness, difficulty breathing, seizures, and even coma. First aid for a person having a diabetic emergency is giving sugar by mouth if they're conscious. You can do this by mixing a teaspoon or two of sugar in a small cup of water. You can give them some candy or maybe a sugary drink. Please make sure they're not sugar-free. If a person has too low of glucose, giving sugar will help the person improve usually within a few minutes. If the person has too high of glucose, the sugar will not improve their condition, but it will not make their condition worse in the short term either. In either case, the person needs to check their glucose level as soon as possible to determine further need for care. If unconscious or the condition does not improve, do not give anything by mouth and activate emergency medical services, and then check for responsiveness and normal breathing. If the person is unresponsive and not breathing normally, start CPR.